Hello, everybody. This is Dr. Kamel again, and a new content related to physical therapy, uh, license exam preparation, and also for clinical physical therapy education. If you didn't see any of my videos before, I work as associate professor of physical therapy in the United States, and I'm a licensed physical therapist in number of states across the US, also in the UK and Egypt. I have got my PhD from University of Nottingham in the UK. So let's go to the content for today. A 70-year-old woman presents to physical therapy with complaints of acute mid-thoracic pain, age, gender, location of pain, that began after spending several hours gardening. What type of activity? She was gardening. Heavy manual work compared to age category. She denies a fall but reports the pain started while bending forward repeatedly. So there was activity which was being done by this lady, and then this pain happened. The pain increases with standing and walking and decreases when lying down. Supine. Always we ask what aggravates pain, what increases pain, what relief pain. Which of the following findings since the patient's medical history would most increase suspicion for a thoracic vertebral compression fracture? Okay. What are the common risk factors? This lady actually has a lot of risk factors, but let's check these other four choices and select one of them. Bowel and bladder dysfunction, smoking and prolonged corticosteroid use, hypertension and diabetes mellitus, emphysema and hormone replacement therapy. Okay, and what is the correct option? The correct option is smoking and prolonged corticosteroid use. Okay, this is the correct answer. We know that thoracic compression fractures is usually osteoporosis related vertebral fragility. So actually, we have a reduction in bone density, which might be common in this lady age as 70 years old, and so gender female 70 years old. So how can this fragility fracture happen? There is previous history of osteoporosis. Okay. So actually, smoking and the long-term use of corticosteroids, and patients they take corticosteroids for so many conditions, maybe asthma, maybe allergy, maybe any inflammation. So sometimes patients take them for long times. Significantly decrease bone mineral density, which we call this osteoporosis if it reaches to certain level. And this chronic use of corticosteroids will lead to glucocorticoid induced osteoporosis. So it is one of the side effects of corticosteroids medication. So what is happening? There will be inhibition of osteoblast activity. We know that we have osteoblast and osteoclast. Osteoblast is a type of cells which is building bone. Osteoclast is a type of cells which is destroying or doing bone resorption. Okay, so there will be inhibition of osteoblast activity with the use of chronic use of corticosteroids, increases in bone resorption, which is a function of osteoclast, reduces calcium absorption, and in older females, like in our case here, 70 years old, this dramatically increases the risk of vertebral compression fracture. Okay. Location again, where? Thoracic spine. And this patient was complaining about acute mid-thoracic pain, which happened after gardening or activity or this activity. Okay. So there was sometimes after minimal trauma, like gardening, bending, and this patient, she said that she was bending forward repeatedly. Okay. So all this presentation means fragility fracture. Very easy question. Let's look at the incorrect options. Bowel and bladder dysfunction. This usually happens when somebody have a spinal cord compression, spinal cord injury, coda equina syndrome, not a simple compression fracture like in this case, you know. So thoracic compression fractures usually will lead to localized pain, increase in pain with weight bearing, but usually there will be no neurologic involvement unless it is really, really severe. You know, this is uncommon finding. Hypertension and diabetes mellitus, cardiovascular metabolic disorder. Okay, they are not primary risk factors for vertebral fragility fractures. Actually, emphysema, uh, pulmonary disorder, hormone replacement therapy. So emphysema alone does not directly increase fracture risk. Hormone replacement therapy, some females they take this after menopause to reduce the postmenopausal bone loss and may actually reduce fracture risk. So they take that to yeah, to make opposite situation, reduce risk fracture, improve bone density, reduce bone loss. So it will not be the answer for sure. So again, what are the high yield or the buzzwords we are seeing in this question? Older females, sudden thoracic pain, bending activity, minimal trauma, okay, osteoporosis, vertebral compression fracture. When I'm seeing these manifestations together, I would say that. And what are the high yield exam points or clues I can take for compression fracture? Sudden pain with bending might be fragility fracture. Loss of height. So the woman may say that she is feeling that she is getting shorter, and this is true. This is due to vertebral collapse, kyphosis due to multiple compression fracture, especially around the thoracic region. Steroid use will increase high risk fracture risk, especially if it has been taken for long time. Postmenopausal female, like in our case, 70 years old, will be associated with osteoporosis. So this was a content for today. Very easy, clinical vignette, clinical related. So if you would like to join my BT license exam preparation course, as you can see, it is not only a preparation for the license exam, it is also making you a better physical therapist by correlating clinical findings, side effects of medication, and different stuff which we are discussing together. Also, if you would like to apply to the transitional DBT program at University of Montana in the USA, and at a discounted rate, please send me WhatsApp message to any of these following numbers: 0014422487206, 0020102774370, either of these numbers, and I will reply to you with the details as soon as I can. Thanks for watching me. Please, if you can, subscribe and share the channel and video with your colleagues, will be much appreciated, and see you in a new content very soon.